Hi, and welcome to our very first episode of Choosing Recovery. Last month, Sherry, Mike, and I all sat down and had a conversation about addiction in our area and just discussed briefly the scope of the problem. So I'm really excited that Sherry has asked me to come back, and we're going to co-host this show together.
We are.
And just really go in depth with what the problem is, how can we reach out to people struggling with addiction, and just discuss some community resources. Each month we're going to have special guests on the show, so I'm really excited to see what all's in store.
Yeah, and we were very excited about this. As Tricia mentioned, when we did the last show, we after it was done taping, we talked about we could do this every show. There's so much information. The community has so many questions. Everyone is touched by this in some way or another, whether it be a family member, a friend, someone. Everyone's wanting to know what resources are available, and we want to explore this on all ends. We want to look at it from the view of the person that is addicted, from the view of treatment options available, from the community health resources, from law enforcement, judicially. There's just so many options. It's endless what we could talk about.
Yeah, it's really a multi-dimensional problem. So I hope that this show will serve from an educational standpoint. You know, just let's help empower and educate the public on reaching out to people struggling with addiction. So I think it'll be a really good opportunity.
I think so as well. And I think today we have a really good guest to get things rolling.
Yes, we do. We actually have Angela Stowers here with us. She's the Deputy Director for the Gaia Jackson Meigs Board of Alcohol, Drug Addiction, and Mental Health Services. So thank you so much for joining us today. I appreciate it. I know we had a little bit of short notice due to unforeseen circumstances for today. So thank you again and welcome.
Thank you. Glad to be here.
So tell me, Angie, as Deputy Director of this board, what's the function of the board?
The local board is really an extension. It's a form of local government. It's really an extension of the Ohio Department of Mental Health and Addiction Services. So we kind of manage things from the local level. So we're looking at partnering with our treatment providers, our educational systems, other human services, elected officials, faith-based organizations, et cetera, to make sure that we have the needed services in place in our counties to address mental health and addiction needs.
Okay. You mentioned needed services in the area. What are some of the needed services that we're seeing in the Gaia Jackson Meigs area?
Well, needed services, there's been such a stark increase in addiction and mental health services all around. There's so many coexisting disorders, which means someone suffers from both a mental illness and addiction. Our jails are currently being filled, unfortunately, with people who are suffering from an illness and unfortunately have potentially committed criminal acts because of that illness. So the needs are great. Treatment facilities are full. We have people on waiting lists trying to get into treatment, especially residential. It's a great need.
Okay.
I think we're seeing a lot of, on the mental health side of things, we're seeing a lot of dual diagnosis, which is, as you mentioned, people have a coexisting condition such as, depression, anxiety, bipolar, whatever, and they start self-medicating.
Absolutely.
And it goes from there. It snowballs. Before they know it, they're addicted. You can't hold a job when you're dealing with this the majority of the time. We've seen a huge rise in crime, in thefts. This is a very expensive habit for people to maintain. I know I've talked to patients before, and they're telling me they're spending a couple $100s a day on heroin. The money's got to come from somewhere for them, unfortunately.
Yes.
And I think the community as a whole is on the end of, on that end of it, the community is very sick of that. It's and then it's a vicious cycle. It comes back to what the community can do to address it, because everybody wants I think initially wanted to treat it with, it's not my problem, take care of those people, but now it's everyone's problem.
Absolutely.
And it's going to take everyone to fix it.
Yes.
Right. So from a community standpoint, I know stigma and judgment is a big factor in addiction, and sometimes we find it's a barrier to obtaining treatment for people struggling with addiction. What can we do to educate the public on what it's really like?
Absolutely. I think as much as the people who are aware of what really drives addiction can, they need to get out there and share that message, and that is that it is an illness. It is a brain disease. It's now going to be considered a medical disorder rather than a mental health. It's really driven physiologically, especially with the opiates. People get very frustrated for the reasons that Sherry mentioned. You know, it's affecting all of us with crime, and our properties are being stolen and damaged, and it's all a result of this issue. But, and I think those people have a little less compassion because they've been victims of that themselves, but the understanding has to be there that it is indeed a disease. Many of the clients that are treated in our facilities have developed this disease as a result of a legitimate prescription. Then there's a number of clients that are in for an opiate addiction at this point that started with an injury. Their physician prescribed them medication. They took it as prescribed, but it has such an impact on our brains when we take those substances that eventually it is not within their control. And I think people just have a hard time understanding that when they've never experienced it personally.
And I think what it comes down to from the medical perspective is people look at it, and to be honest, I kind of look at it this way too. That first choice to put a needle in your arm or to snort heroin, that's a choice. We need to educate people as to not make that choice. And I understand the disease, the disease process and that model with that as well. But and it's the same thing, medically when you're looking at it, is say everyone in your family has died of lung cancer. Don't start smoking.
Absolutely.
There's addiction issues that run in your family. Don't start taking these things. But then again, you've got a very legitimate point with, people are given prescriptions for opioids, whether they've had a surgery, whether they've had anything like that, and then they become addicted. We deal with it every single day. So it's a very fine line there. There are a lot of legislature changes that have came down the pike recently that have changed prescription practices for providers. Unless you have a severe chronic pain issue, you're not going to get more than 2 weeks of an opioid pain medication at a time. And it's very cut and dried as to what they can do and what they can't. I was told there's something coming through that if a provider has more than, I think it's 40 or 50% of their practices on opioid pain medicine, that provider's going to start getting fined. So there's incentives on that end to address it. But it's going to take the whole picture to do it.
So how can we account for the choice factor when, not everyone that starts using has done so because they've been prescribed it as a result of an accident?
Right. I think what Sherry alluded to, and that's prevention efforts, prevention and education, getting the message out there of what the results will be if you do make that choice and where someone might end up. We have provided a number of treatment resources. We have a number of people in treatment, and we are seeing greater success rates with that. But the ultimate goal is let's not get people to where they need that in the first place. So really increasing prevention efforts, making sure that the community comes together and provides that outreach and education and helps to make people aware that they should be even questioning prescriptions that they are given by their physician and making sure that they're not, making poor choices.
Yeah, because there are people that are free with their prescription pad, and that needs to be, and I think there are things coming down the road that are going to help address that as well.
Right. So in clinical experience, and again, not getting too specific, what's some reasons why people have chosen to begin using? Is it psychological pain, trauma? Social factors?
I think everyone's journey is very individualized, but as Sherry mentioned earlier as well, mental illness, depression, anxiety, trauma, there's a huge association with previous trauma and addiction. People have suffered these things and begin to just try to feel better and self-medicate, as we call it, and it just gets out of hand, and they're not getting, perhaps because they've chosen not to, because we do have resources available, but they haven't accessed them for whatever barrier or reason. They haven't chosen to treat the mental illness in a way that would be more effective, and it's caused them to have another illness on top of it.
So what I'm hearing you say is a lot of times addiction and mental health go hand in hand.
Absolutely.
You can't treat one and not the other in a way.
Oh, absolutely. If there's a coexisting disorder, both have to be addressed.
And I think that is one nice thing, working with the county jails and the judicial system and law enforcement. It's going to make their job easier in the long run, offering these services through the jails, treating these illnesses, getting these people the help they need to hopefully give them the choices they need to make the right treatment options to prevent from putting themselves in that position again.
Absolutely. I would also just add to that, we are able to provide those services locally in our jails due to grant funding and monies that have become available on a short-term basis in some cases. When someone is incarcerated, and even if they qualify for a medical card, they do lose that when they're incarcerated. So it really limits what our treatment providers can do to help them in that situation. And many times someone doesn't feel motivated to obtain treatment until they face that criminal charge and are in that situation. So the community having that awareness and knowledge and petitioning your legislators and people that can make these decisions about funding is a huge, would be a huge step in the right direction too for making sure we can maintain that or sustain it in the long run.
And for a lot of people, I think sometimes being in jail is the first chance they've had to be clean. Although it's it's not by choice, they're going to get clean one way or another while they're there. So that's that's the perfect time to target these people and say hey, we realize there is another issue going on here. Are you interested in treatment? Do you want to try to help yourself? And then it may be the first time that fog is lifted enough from addiction that they can make that choice.
Exactly.
So the title of the show is Choosing Recovery. What's it take for individuals struggling with addiction to choose recovery?
It takes a lot of support, I think. It takes a lot of courage. I mean, people who are, especially those who are addicted to opiates, the withdrawal that a person experiences when they are trying to stop is severe. With opiates, there's not necessarily a risk of them actually dying as a result of withdrawal, where there are with other substances like alcohol and benzos. But there's still, the symptoms of withdrawal are extreme. There's such a psychological dependence as well, and it all gets tied together. The physical, I've heard it described as the worst flu you've ever had times 10. People really struggle with a lot of body aches, pains, physical illness, and then again, it goes back to that psychological. There's almost a pattern behavior to their addiction at times. If somebody was used to waking up every morning at 5 a.m. and getting high at that time, they've got to find a replacement behavior for 5 a.m. because psychologically that's what they've done, that's what they've known, and it's part of their pattern and their routine. So yeah, there's a lot of work that goes into recovery, and that's tough for people. And many times people are part of generational addiction. They don't have sober supports within their household. A lot of times it takes cutting ties with everybody that they've known as family and friends to get themselves surrounded by people that are going to be supportive, and that's huge. It's very difficult.
We talked in the last show about rock bottom, and that's a common term, in addiction conversations. What is rock bottom, and how it's different for everybody?
Yes.
But what would it take for that person to finally say, okay, I've had enough, or I need to make a change?
Yeah, well, like you said, it's different for everyone. I don't have the answer to that question. My rock bottom would be much different from yours, as it would be from anyone else's. For some people, it doesn't take as much as it does for others. I really think, and we talk at the board very often about developmental assets and risk and protective factors, and that's kind of an approach that prevention uses. But in my mind, I think about people who are better able to enter into treatment and recovery having a higher level of those protective assets. They've got more involvement, maybe they have a job, maybe they have somebody else in the community that they're tied with, maybe they have a faith base, to their existence, whereas someone who struggles more greatly may not have as many of those protective factors. So it's very individual. I wish I knew the answer.
And I think that's a sad thing too, is because we see multi-generations at this point of families being addicted. You see, I've personally in the office have seen grandparents, parents, and now you're looking at teenagers that are having addiction issues. And you really, you feel bad for that child coming up in this environment because that's all they know.
Exactly.
That's all they've seen. You know, it's nothing for the whole family to sit around and smoke a joint or shoot up or whatever they're doing, and the parents don't realize, you know, I'm sure they realize, but it's like, it's no big deal almost.
Right.
You know, and the same thing you see a lot with a lot of the, like for example, hepatitis C is rampant right now as a result of everyone shooting up in the heroin. And people are almost, I actually had to tell a kid here a couple years ago that he was hep C positive. He was 18 years old. And he was like, everybody I know's got it, what's the big deal? And, you know, trying to make them comprehend, we're going to face an entire health crisis with that down the road, because the population that have, that are developing this at this time, you know, it's going to be an issue down the road. They may not feel bad and be sick right now, but eventually they will, and it's going to be it's going to be significant.
With it being a public health issue, are local health departments becoming involved in addiction treatment in any way?
Absolutely. The local health departments are trying to reach out, provide some education. I can speak specifically to Gallia County. They have a very active program, syringe exchange program, and they are involved in Project Dawn, which is the naloxone kits to help reverse an overdose. The syringe exchange, I think at last count they had served about 150 people on a regular basis. So that's a weekly count of people who are actively going in to exchange their needles here in Gallia County alone.
So they're taking their used ones, getting new ones to the health department?
Correct. And there's a lot of controversy around that, but just as Sherry was sharing, the health consequences and the crisis we're going to face there, the amount of money it costs to treat one person who is hep C positive is enormous.
I believe, I worked with the VA system, and when we would treat a veteran, I believe, I may be wrong, but I believe it was somewhere around the $60,000 to $70,000 range for treatment.
Right.
And that's significant when you times it by the amount of people that were seen positive at this point in time. And I've actually had people come back after they do the treatment and retest positive because they went out on the street and started using again, and thought that meant they couldn't get it again, but they can.
Absolutely.
And then they were upset because they weren't retreated again right at that point.
Yeah.
So naloxone kits, that's Narcan,
Correct.
and that's also controversial. I know people in the public feel as though that's creating a dependency, that's enabling users to continue use, or saying that it's okay. What's an alternative view of that?
Well, it's saving lives, and we look at someone that you care about most deeply, your child, your brother, your sister. If they're laying there and need that medication to bring them back just one more time, you are going to want that to happen. I'm going to just use a reference that our executive director, Robin Harris, uses in an example, and it's a fabulous one. We are also in a health crisis when it comes to obesity and diabetes and these kind of things, heart attacks, heart disease. So she even said this recently in some presentation she was giving. If we're standing over someone who's overweight and we know just ate another cheeseburger and a candy bar and they're having a heart attack, are we going to look at them and say, oh, sorry, no CPR for you because you knew better, you shouldn't have eaten that cheeseburger?
And that's a great point.
Yeah, I think that's a great
Yes.
example and demonstration of how we have to view this as an illness and really try to bring people back. I mean, how many people do we know that have had multiple heart attacks or diabetes or strokes because of their poor health choices?
Yeah.
And what's the difference?
Yeah.
And one thing I know I'd seen somewhere, and I don't remember where it was at, but there was a community that was looking at charging people with some sort of, I don't know if it was, I'm sure it was a misdemeanor. If first responders, law enforcement, EMS had to show up and use Narcan on them, that they would in fact be charged with some type of crime for their use. I would tend to support that more than saying we can't give it to you. And I understand the people are frustrated and it's expensive, and you have people that can't get the medications for diabetes and things like that that they need. But also, again, I think we talked about this on last show too. If it was my child laying there or my grandchild laying there, absolutely, you want everything done.
Yeah.
But I think there does need to be some consequences. I don't know what that would be, and I don't know how that would happen. But I think there needs to be
What are
something.
we seeing from the state level? Is legislation coming down the pike that it would be a criminal offense if you use Narcan?
I am not as up to date on that as I ought to be,
Okay.
and I'm not sure. As far as I know, there's nothing on my immediate radar that's saying that's going to happen in our area. I know there are some bills and laws coming down in West Virginia where they're trying to push that through. Like I said, nothing on our immediate radar. I personally would support it. I feel like, again, many of our people who enter into treatment are motivated by justice in criminal charges, so they don't feel that need to really to make a change until they've had that type of consequence and have had that opportunity potentially to sit there and be clean for a few days and experience it. So I would like to see us put some more supports around that kind of thing so that we could get people into treatment. We're looking at trying to develop a peer recovery support network. I think there's a role for people who would fall into that category, and that's part of the continuum of care. That's a treatment avenue in a sense, where someone who has suffered addiction and is in recovery has been able to go through some training, get some certification, and be available to be almost a recovery mentor or a recovery coach. And I would love to see us be able to put those resources in place for someone who's been delivered Narcan to say, hey, now's the time, let's get you in there.
Well, and I think that's the thing too, and I think the people I think that have went through this themselves personally and have personal knowledge and experience of being an addict make the best counselors.
Absolutely.
Because we can sit there and talk to somebody until we're blue in the face, but we've not lived what they've lived. If you have someone that has the same experience that they have, I think they're more likely to listen to them, that says, hey, I was there, I know what you're talking about. I think one option that I really 100% back is Vivitrol, and we do that. Some in the community, there's different places that does do that. It's a great option, and it is an opioid antagonist, and what it does is it blocks those receptor sites for opioids, so when someone uses, they can't get high, essentially, is what it does.
Right.
But there's a lot of, and I think what I tend to have seen in practice is that people that truly want to stop using are 100% behind Vivitrol.
Right.
People that don't want to quit, you hear that, well, what if I'm in a wreck and I need pain medicine? And there's, so there's always a reason not to use it, but, and there are ways around that. But Vivitrol is an excellent option. I do believe that medical cards are paying for that, I believe.
Yes.
So if someone has CareSource, Medicaid, whatever, it does help take care of that. But it's a good option. And usually what I have seen in practice and by talking to people that are on Vivitrol is they may use it and then for whatever reason, I'm going to see if I can get high. And they try, and then they get mad because they've wasted their money because they can't get high. Although, you do want to caution people that, there is always that option that if, they're using huge quantities, they could overdose, or if they go off of it, and it's a shot that you have to do once a month. And that's the thing is if they don't maintain that, then they, if they go more than a month without having their shot and they start using again, there's a high rate of overdose simply because their tolerance is down. And I think you see that a lot anyway of people coming out of recovery that relapse. That's the period you see a lot of overdoses because their tolerance is down, and they go back to using what they were using before, and then they overdose.
Absolutely.
But it's a great option.
So what's some resources in the community if someone's interested in Vivitrol injections?
We have a number of providers that are offering that service. We refer to it as medication-assisted treatment. So there is Vivitrol. There are other medications that can be used as well. But Health Recovery Services, Ohio Valley Physicians, Dr. Landry's practice, there are several that are offering that service. The best thing that someone could do potentially if they were seeking out a service would be to call us at the board, and we could link them with services that offer what they're looking for.
So even someone just generally struggling with addiction that doesn't know what they need, you would be able to kind of link them with services.
Absolutely, that's our role. Get them where
Wonderful.
they need to go and link them. And what we do, we have a list of our local providers in all 3 counties. We provide them with that, give them the information on what resources are available at each location and provider, and we send them out, and not on their own necessarily. There are many times that we make calls for them and with them to make sure that they get there, because that's tough. And there's so much of the time we have people that'll say, well, here's your list, call these people. Well, they're already having a hard enough time even making that initial call to us.
It's a very overwhelming process for people.
We would want to work very hard to link them.
Where would people be able to get a hold of you at? How's the best way to contact you
Sure.
at the board, or call the board?
Yeah. The number at the board is 740-446-3022. And all of our staff there are very able to take calls and get people linked up with where they need to be.
So I really wanted to take this opportunity to talk more about what the community can do to reach out to people struggling with addiction. What can families do?
Families of addicts or
Yes.
family, yeah.
So I talk to a lot of parents, mothers, you know, they just don't know what to do.
Well, again, just educating themselves, trying to learn about codependency and enabling, because that's huge in families
Yes.
with addiction. There are resources, again, available in Ar-Anon. There are some treatment providers that have groups and services specifically for the family members of addicts that will help them to learn about that stuff and change their behavior to help the addict recover. So there are things
Can
out
these
there.
people call the board too for available resources?
Absolutely. And all of our counties have local coalitions working right now. So Gallia, Jackson, Meigs, all three have coalitions in place where people are coming together to try to address the
And anybody
issue.
can join those coalitions?
Absolutely,
Wonderful.
absolutely.
Is there any activities coming up people can get involved in?
We actually in Gallia County have a dodgeball tournament this Saturday that's meant as an alternative drug-free activity and a fundraiser for that coalition. It's at Gallia Academy Middle School, registration at 9 o'clock on Saturday.
Wonderful, wonderful. Well, I really appreciate you coming in to talk with us today, Angie. It's been a pleasure.
I'm glad to have been here.
Thank you very
Thank you.
much. You're a great resource.
Yes.